If we look at the field of transplantation, it's compared to other things in medicine, it's pretty young. And University of Rochester's been a leader in that historically, and we're doing things here that are introducing therapies to the rest of the country and the rest of the world. So it's a transformative program.
Liver transplantation is very complex. We need an expert from a variety of areas. On top of that, our patient population is very unique, including cancer populations. So it's really teamwork to make sure a patient can have a good outcome after liver transplantation.
We have about 90 people on the core transplant team, and all of them play a really key role in getting our patients through the door and to their appointment with all the right testing, and then on to the treatment that's going to help restore their health.
I think that building trust with patients is a huge strong point of this entire team. Universally, when I talk to patients, they tell me, wow, this was so much different than the other places that I've gone. I really appreciate calling and talking to a person. I really appreciate feeling heard. I want to be on that person's level. I want to connect with them, whether it's a 78-year-old woman trying to come here for hepatic histotripsy, or whether it's a 23-year-old who has been given the diagnosis of metastatic colorectal cancer to their liver.
The Living Donor Liver Transplant Program has completely revolutionized, and that's the appropriate word for it, because we're one of the only centers in the country that does this. Multiple years in the last decade, the University of Rochester has had the highest average severity of illness in our patients that we transplant compared to the other centers all across the country. And despite transplanting the sickest of the sick patients here, our outcomes are as good as any other center in the country.
The team is so dedicated to our patients. When a patient comes to us, they are literally ours for life. We take that patient from evaluation through pre-transplant, post-transplant. We follow up with them, and it's so moving because you realize that we didn't just save one life, we made a difference for an entire family.
When we start to do research and we come up with something new, all that research then opens clinical trials and puts us on the map as a center, and that drives the clinical mission. We see more patients, we have higher volume, and all of those things then also drive the educational mission, because then the best and the brightest want to learn how to do that here, and they train here.
The University of Rochester is on that cutting edge of expanding the capabilities of transplant and what it does for patients. These interventions are now becoming therapies that are life-saving above and beyond just long-standing disease for a liver, a kidney, a pancreas, treatments for cancer as an example.
One of the technology we want to bring to University of Rochester is the machine perfusion of the liver. If we preserve liver in a standard fashion in a cold ice, it may last only 10 hours or so. However, if we place it on the machine perfusion, which provides some oxygenation, we can even preserve up to 30 hours or so. So with that, we can even try to save more people with this cutting-edge technology.
The way that we get research projects off the ground to that fundable scale from the federal government or from large societies is philanthropy. It's our venture capital, it's our seed money.
Ultimately, our goal is to make the Transplant Institute a destination for transplant care for patients, not just here in Rochester, but across the country. Right now, no matter how hard we work, no matter how hard every aspect of transplant pushes, we can only open that door so many times. With more resources, we can make sure that door stays open for everyone.